All right, thank you. Good morning, everyone. Good evening, Katie. I'm so sure it's really late there in Canada, but otherwise, we're happy to have all of us in this session. Very, very happy that all of you could make it. Thanks, Caroline. Thanks, Ivy, for all the organizing. Thanks, Lenita, for joining. Mazina, thank you. Mike, thank you. Just to again remind us, we already have this program. Our session is for 90 minutes, so we want to see how much we maximize our time. The session is titled Intersectoral Collaboration, Integrative Governance on the Road to Urban Health. I mean, that's the word today: integration, intersectoral collaboration, participatory approaches, so that we leave no one behind. So we're gonna look at 3 projects, which all of us here are connected with. And the program is set down there. Ivy, you can go quickly. Yeah, we allocated some time. We want to see to a very great extent how we follow that, to be able to go through all we want to go through and then give room for our participants and panelists to speak to the issues. All of us are panelists here, and that's why you can see your name in the program. So I don't want to take a little more time on that. I will just go roll it up. Yeah, keep rolling it. No, you're going down, go up. Yeah, so that we see the rest. Yeah, so there will be a video clip that's playing during our short break. And that is when we transit to key responses. Our thinking is very simple, that our PIs and those leading these projects will speak to what we are doing on the ground, particularly in Kenya, around these projects. And then we have our KUSH PI here, Professor Mike Davis. We also have, I've not seen Prof. Thompson, but I'm sure we are persuaded he would join us from Wellcome Trust, who is the funder. He will also be able to respond. We have a RISE PI representative. Our PI is not able to make it, but she sent Dr. Katie. Katie will speak about ARISE from the global perspective. And then Mazina is here, she will speak from the perspective of the funder. We have Gijo. We are looking forward to Professor Wrigley, who is leading the sisters' work in Kenya and in Ghana. Then we have Dr. Sumba, who is a partner of sisters, as well as Katie, who is the funder. So they will all also have time to speak. We allocated 12 minutes each for those, and we hope to see how much we stay on the timing. But you know, sometimes we can have a few minutes or a few seconds below or above. Then we'll have concluding feedbacks, questions, and then Dr. Caroline Gabaria, who will also speak on ARISE, would then give us concluding comments. So that's the program we have. We are hoping we fit it in. So I want to go straight, Ivy, you can stop sharing this now. I want to go straight to the first role which I was given, and I want to share my slide. Please confirm for me that you are seeing it. Okay, so that's the title of the session. And our thinking around this session is the fact that these projects represent, they typify the new push towards or the reinvigorated push towards intersectoral collaboration, integrative governance, planning, working, devising solutions by everybody, not just from above, but also from below and even from the middle. So our whole thinking comes from the fact that if you remember MDGs, if you look at MDGs, what you see is that it was a little bit siloed. It focused more on single sectors, approaches, which was identified as a key weakness. But that single sector approaches to development, has shifted to integration of both economic, social, environmental dimensions of sustainable development, and the interlinkages also between and across goals, which was part of the SDG. So it marked a watershed, if you like, a watershed approach to development, at least since 2015. Development, even in terms of policy making, policy implementation, and so on. So beyond breaking the silos, which is like the hardware of development discussion, there was also the software dimension, which SDG brought on board, which has a lot to do with building on a more cross-sectoral decision-making, multi-stakeholder partnership approaches, identifying various nexus, various clusters, links and linkages among sectors, So, and that has been what we see as a common thread running through these three projects. And we thought it's important to highlight those because it links local challenges to global agenda, but it also links global thinking, global solution to local solutions, local ideas, lay perceptions are also taken into consideration. And there are two quick examples I want to give here. The Public Health Agency of Canada in 2020 defined intersectoral collaboration as, as about joint actions by health, but also in conjunction with other government sectors, representatives from private, voluntary, and non-profit groups to improve health of populations. So, and if you look at that definition, which is consistent with the point we are making here, it talks so much about cooperative initiatives. It talks so much about alliances, coalitions, partnerships, early engagement of potential partners from the sectors outside health, but also from different disciplines and levels within the health sector. That movement shift towards collaboration, cooperation. But in research also, we are seeing that because that's where we really work primarily. In research, we are seeing intersectoral perspective, finding expression in interdisciplinary and transdisciplinary partnerships and collaborations, both in problem identification and evidence generation. And that principle is very, very relevant for policymakers who are dealing with a lot of spectrum of challenges that require spectrum of methodologies. So it is really hard under this dispensation to talk about one model that fits all. It gives room to bring everybody on the table. And that is the heading of this. Who gets seats at the table when you are discussing health? And the 3D Commission asked that question in one of the panels that it published in this year in the social social determinants of health and decision making. So we see that collaboration going on. And so for us, therefore, both in Africa and APHRC where I work, and our partners, which all of you represent, for us, we are thinking, and our thought is that advancing inclusivity and sustainability, which is the key goal of these are policies. Advancing, inclusivity and sustainability in policies and action. They are the guideposts we get from the SDG 2030 Even AU Agenda 2063, the Africa we want. And if you look at the new global agenda, this issue of advancing inclusivity and sustainability remains critical. So the goal of inclusive and sustainable urbanization in Africa is no longer only about identifying problems, but it's also about generating context-specific evidence and finding and testing solutions that are co-created by both the professional, but also by the community. So in this session, therefore, we seek to share lessons in our search for pathways towards inclusion and sustainability in Africa, building on the 3 projects that address marginalized and vulnerable populations. The 3 projects, as we're going to discuss them, you will see that they speak about inclusion of both ideas and solutions from below, from the middle, from different government departments, okay? You know, making sure that no one is left behind, making sure that the most vulnerable are included, both in problem identification and solutions. And in our toolbox, I believe what we have are many, but at least there are very key tools: system dynamics modeling, collaborative and participatory approaches by all stakeholders, the whole idea of co-creation of both policies and solutions. So that's in essence our vision for this panel. That's what we see moving forward. And I want to take a breather there to say this is our vision, and I hope you are hearing me. We will, of course, give you time in the sessions as scheduled to speak to these issues in terms of the future, both future of research, future of interventions, future of policies, and future of action in addressing development across the region. So quickly also, let me give one example of the project, because I am leading the KUSH project in Kenya. So I want to share quickly what we do, what we've been doing under the KUSH project. One of the key issues is co-identification of what are the biggest challenges for sustainability and health in Kenya. Here we worked with 3 counties, Nairobi, Kisumu, and Homa Bay. But the examples I'm giving here, I dropped Nairobi because we have not advanced as much as in these other 2 counties. But we worked with the counties, we worked with the officials, we worked with their communities to find out what are their biggest challenges for sustainability, you know, and health in the counties. And what we have there is what they listed: waste management, air pollution, poor water quality, urban sprawl, and high vulnerability to climate change. In the case of Kisumu and Homa Bay, there is a lot of flooding. Those who are in Kenya will always hear about Serikali's idea. Whenever you hear that, it is where is government, because flooding has come again. But beyond co-identification of challenges, we have also supported the development of local spatial plans. You see, you can, for cities, these areas are growing very fast, but there are no primary spatial planning. And in the process of interaction, this was one of the solutions the county government found we are committed to do. And because KUSH project has people who have those kind of expertise, we supported them in many ways. And today, Oyugi's spatial plan has actually been gazetted. It is now law. We are still in the process for Katito, Kombewa, Muhoroni, and Sondu. These are in Kisumu County. These are 4 new towns that are being planned. And what do we provide as technical support? GIS-based baseline study, demographic and employment growth projections, co-elaboration of vision and objectives, development of county spatial framework, and growth options, showing alternative approaches to physical development and their performance against sustainable and health objectives. We did a lot of work to bring our expertise from Kuch to support this integrated plan development in these 5 towns now. We also offered training and capacity building for key technical staff, particularly around the built environment. You know, expertise that are needed towards not only spatial planning, but implementation of the spatial plans when they are finally, finalized. Specifically among the technical expertise we were able to share with the technical staff is actually on GIS expertise, on Earth observation, how to use these innovative technological approaches to enable spatial plan implementation. We also have supported the Kisumu County in a Green Climate Fund application. If you look at the major problems they identified, one of them is waste management. So, and we were able to identify the Green Climate Fund as a place the county can apply to get funding for some climate mitigation projects. And we have done that application. It's still ongoing, but that application has advanced because the national accredited entity has, National Designated Authority and National Accredited Entity have supported that application. I believe as of now, that application has been submitted. So there are other things we are doing, but I want to stop here because we did a project on public engagement, also on solid waste management. And I want to stop sharing because I want to invite Dr. Ati. I hope Ati is now here. Ati, to share with us also how this engagement brings to the fore the views, the understanding, the challenges from the lowest of the Kisumu city. Community members, how do they see these things? Because it's not just that solid waste management is the problem of government or a problem of the SDG. No, it's also a problem in the community. Ati, I want to stop here and give you time to take it from here. Thank you, guys.
Shall I share my screen?
Yes, you can now.
So one of the things that colleagues in Kisumu told us was really important to them was waste management. And that's because Kisumu is very interesting. If you know the map of the city, there is some waste collection in the market areas that the government collect. If you are a wealthier person, then you pay for waste collection. But if you are the 60% of the population or so who lives in the large informal settlements, there's absolutely no waste collection at all. But what's interesting about that is the settlements are behind the areas where waste is collected. So it's not necessarily an issue that is visible to people, to the public, for keeping it on the public agenda or the policy agenda. So we wanted to tell the stories of people who are reusing, recycling, repurposing their waste, people who have come up with innovations. And we wanted to tell those stories for 2 reasons. One is because Kisumu County was drafting the policy on sustainable waste management, but they hadn't recorded the voices of the majority of the population who have zero waste management. And so that was a public participation exercise, which, as you may know, is in the Kenyan constitution, but they didn't have the funds to do it. Or sometimes it's not done well. Sometimes in some counties it's done incredibly well, where people feel really empowered. But in this case, it wasn't so. And so we wanted to tell those stories in 2 ways. One is by bringing together groups of women, so women of many ages, of school children, and of waste stakeholders who are themselves waste pickers, who we call the waste experts. And the other way we wanted to tell those stories is by working with journalists, so local journalists, to help them to understand how to report about environment, about science, and about health, to leave that as a legacy training for them. And what the journalists then did was work with unemployed youth in the informal settlements to train them to be a citizen journalist, so that when the project ends and we leave, they are still able to engage with any issue in their environment and go to the government and be able to go to the press and have that in public engagement. So these voices have been speaking to Kisumu County government, and they have been also speaking to local and national media. It's been covered on the radio, in the newspapers. And what I wanted to share with you today is we've been making a series of films, because one of the things we realized is the waste pickers have been telling their stories to the government for a long time, but they've never been recorded. And I wanted them to feel like their voices were being heard and being shared. So the film I want to show you is a short film, and we sent it to the WHO's Health for All Film Festival, and it was shortlisted. And I was so happy because Isaiah Manyala, who you're going to see, is such a key person to our project. He's 28 years old, and he has innovated, and he's training young people, and he's a real pillar of his informal settlement in innovating in waste collection. So I'll show that video now, and thank you for your attention.
Obunga was dirty. People could not manage their waste. There were no waste collectors within the community. My names are Isaiah Odhiambo Manyala. I was born, brought up in Obunga. I'm 28 years old. What I'm doing for a living is waste management, where we do collect waste from households and we get paid for the services. Long time, the community were not informed on where to take waste, how to separate waste. So they were just throwing waste carelessly. Our community was dirty. So we started by cleanup exercises where we were cleaning the area people used to dump their waste. We were advising them to give us, to collect for them. We don't get much from waste, but we are passionate about waste. Pesa yenye napata at least inanipea, naweza lipa rent, naweza provide for my kids. We've managed to employ some youths who are from school. I can say today Obunga is clean. I'm proud that I've done a lot in Obunga with my team. The job I'm doing, I'm proud of it.
Thank you very much for your attention. Thank you, Blessing, for inviting me.
Thank you, Artie. Thanks, everyone. Please keep your notes going. But we want to invite Caroline to share her screen if she wants to share some slides, but to take it from here. Caroline will talk about Arise project, which also speaks to inclusion, Kulu speaks to sustainability. Caroline, over. You can introduce yourself too, please, where you are speaking.
All right. Good morning, Blessing. Good morning, everyone. Blessing, please confirm you can hear and see my slides correctly.
Sure, sure.
All right. So good morning, afternoon, or evening, wherever you are. It's a real pleasure to be here with you today to speak about the ARISE project. I'll tell you shortly what the ARISE project is about, but my name is Caroline Kabaria. I work as an associate research scientist at the African Population Health Research Center and the Population Dynamics and Urbanization Unit, where we look at we look at urban populations, but you find that a lot of the people who are lacking services, access to water, sanitation, health, are mostly living in informal settlements, and that makes us the focus of our work to be informal settlements. So today I'm going to talk about the outcomes of a project that is currently ongoing in 2 informal settlements here in Nairobi, Kenya. That is Korogocho and Viwandani informal settlements. And as titled in my presentation, we did some mapping. We did some mapping of the social and governance terrain in Nairobi. So the ARISE project, the ARISE project stands for accountability and responsiveness in informal settlements for equity. This is a UKRI GCRF project. Our hub is known as the Accountability for Informal Urban Equity Hub. It brings together researchers from the UK, Sierra Leone, Kenya, India, Bangladesh, and yes, so the five countries. And the hub works with communities in slums and informal settlements to support processes of accountability, related to health. So the presentation I'm going to make today is based on work that we did in Korogocho and Viwandani, as I have mentioned, that is part of the Kenyan work. And the overall hub has 3 programs of work. One that looks at the conceptual, methodological, and theoretical development outputs. The second one looks at empirical case studies. And the third looks at collaboratively developing and piloting social accountability strategies for equity, equality, and well-being. So the work I'm presenting today is around the second research program, which looks at empirical case studies. So the work is divided in various work packages and named work package 2.1, 2.3, 2.4, and so on. But today we'll concentrate on just work package 2.1, which looks at mapping the social and governance terrain. And this is conducting geographic and social mapping of community and governance structures, including local stakeholders as the main objective. The research questions we are trying to answer here is what are the key social inequities within informal urban spaces, and how do these influence the health and well-being and access to health or other services of marginalized slum residents in Nairobi. So we take 2 approaches through conducting the social mapping, examining the role of community advisory groups, conducting participatory GIS, as well as stakeholder profiling. So on the social mapping, this is work that we did, we have already completed. And the approach that we did, this was a qualitative approach where we did qualitative focus group discussions. So 40 focus group discussions were conducted in both Korogocho and Viwandani. And they brought together groups, so separated groups for community members, disaggregated by age and gender, village heads, persons living with disabilities, sanitation workers, and garbage collectors, community groups, refugees, commercial sex workers, community health volunteers, and parents who have adolescent and young children. The community profiling was also taken through a participatory approach. So focus group discussions together with participatory GIS. And these were 20 focus group discussions in Korogocho and Viwandani. And then this was followed by some ground truthing. So again, the kind of groups that we worked with were village heads, persons with disabilities, community groups, community health volunteers, and parents with adolescents and children. And as you can see on the right-hand side, this involved having printouts of the maps, and working with the different groups to identify various social amenities within their communities. And then this was followed by having some field interviewers going to the community to confirm the location of this. And from that, we're able to map, for example, water points, sanitation points, and so on and so forth. So by working with the social mapping, we're able to ask all this. So this is a group that is a mix of supposed to be a representation of the community. And we try to ask them who they think is marginalized within the community. So it is interesting that when we think about informal settlements, we think that everybody there must be marginalized. But what we continue to find out through this study is that there are people who are more marginalized in this community, and they're identified by even the residents of this informal settlement. So we try to look for 3 priority groups to work with. And the first group that was identified is persons with disabilities in both Korogocho and Viwandani. So this was identified as a major marginalized group. The elderly was also identified by study groups in the 2 communities as a group that is marginalized. And lastly, child-headed families. So these are households where the head of household is younger than 18. And so our study carries this forward by working with these 3 groups from these communities. So in terms of priority areas, again, identified generally in the community, we try to prioritize 4 to see what we can work with. And this is, of course, we would like to work with more, but we know that resources are limited. So what is shown on the left-hand side is the areas of priorities affecting the health and well-being of residents of informal settlements. So water, health, education, sanitation were selected as, we identified this as the areas to pick up for this study. On the right-hand side, I'm not going to read through that, but there were various suggestions of what the communities would like to see improved. So for example, water, they'd like to see the condition of the water pipes improved. In terms of health, the management of medicine, education, availability of reading materials, sanitation, renovation of toilets. So there's a whole list that was identified by the groups that I mentioned earlier. So at the same time, we tried to see who is working in this community. So we conducted what we call the 5 W. So who is doing what, where, and when. And from this, we're able to identify different sectors that are engaging in this community. So a lot of groups are working on health. A lot of groups are working on nutrition, education, spiritual support, counseling, behavioral change, security, child development, solid waste management, WASH, persons with disabilities, housing, and legal. So this is split between the 2 communities. So we can see there's a presence of different groups of people working within these communities in the various sectors. In terms of the community advisory group, so within every community, when we are conducting our research, we have the community advisory committee, which is constituted by representatives of the administration. That's the chief. We have representation from the village elders of the different villages within the communities. We have religious leaders. We have representatives of youths, persons with disabilities, women. I don't know if I've left anybody else, but it's a group of, so every community has a community advisory group, but we wanted to understand how the community views them. We wanted to understand how the researchers then see the utility of this community advisory group. And what we're able to see, to identify through interviews in the community, was to see that the community advisory group plays a key role in advisory, as an advisory both to the researchers and what are the priorities for the community. It plays a role in creating education and awareness. It works in advancing project goals in terms of research and implementation. It also works to protect the interests of the community, but is also viewed as a gatekeeper. So I said we also conducted, so from the 4 areas identified that I mentioned earlier, the 4 sectors, water, health, sanitation, and solid waste management, we then now went to work with the groups that we identified that are marginalized to identify then how are they affected in these areas. So this was done through governance diaries and photo voice. I'll present the results of the governance diaries. So this started by consultative meetings with the communities and identifying groups. So 32 participants were selected. So 4 from each of the 4 groups that we said are marginalized. So we have a fourth group, which is the daycare centers, and this is related to a PhD we have within the hub at EPHRC. But I'll concentrate on the results of the three groups: the persons with disabilities, elderly, and the child-headed. So from trying to identify the thematic areas through governance diaries. So this is done by having a field worker visit the identified households and just hearing how their week went and trying to hear where they were able to have challenges or areas of improvement within the thematic areas we had identified. But through the governance diaries process, you're able to identify 2 more areas of working. So we're able to identify 2 priorities areas in addition, highlighted in red, that is the solid waste and the hygiene. So 6 visits were done over a period of 4 months to the identified households. So this shows the process of working, the informal discussions with the field interviewers. Participants kept diaries of how their week were. The field interviewers had reflective sessions to see what they were observing in common or different in the households they were visiting, and also making observations as they were going to the households. So from this, we're able to identify the social actors and networks affecting the people within the community. So in terms of the social actors, so these were identified by the vulnerable and marginalized groups. So we have community-based organizations, family, friends, parents and guardians, the county government, social workers, NGOs and external partners, as well as teachers and childcare owners for the ECD work. In terms of the social networks, and so these are the people who the communities went to when they had challenges. So mostly we have the actors that are highlighted in blue, which are external actors, but then you also have communities relying a lot within their family. So they are close family members, extended family members, the community itself and neighbors as the networks that they work with. In terms of who has authority, we have social institutions, we have local leaders, we have the ministries, the government ministries, and external leaders. In terms of marginalization, and I'll just give a snippet of some of the work that we are seeing. So for example, from the elderly in Viwandani, solid waste management, they saw this as an area of marginalization, sanitation, health, education, and water as an area of priority that they'd like addressed. For the child-headed households, you have the education, water, sanitation, solid waste management, and health. So this is the order of the 4 themes, what they'd like addressed first. And I'll just read some excerpts from an older person in Korogocho, who says, I would say education is important, followed by health, water, toilets, and hygiene. Without education, you're not able to get employment for you to earn a living and pay for services in the health facility. You will also not be able to afford water, toilet services, and maintain hygiene if you do not have money. And as a comparator in Viwandani, an older person still, saying that they think health should be put first because, as I always say, a sick person cannot be helpful or productive. The second is the issue about water. Water is medicine, it is life, it helps a lot. Toilets and education are also key for a good stay in the community. Comparing child-headed households between Korogocho and Viwandani, an excerpt, I can say health, hygiene, water, and toilet are most important. Health comes first. Without health, you're not whole. Without hygiene, toilet, and clean environment, you're not a normal person and can be sickly. Similarly, in Viwandani, we can see a child-headed household saying, I can say water, education, health, garbage, and toilet are of priority. Education, water, and toilet are the key because you cannot live somewhere without a toilet and water. You also know. Without education, you cannot understand many things happening in the world. You cannot live in a place without a toilet. So those are excerpts from the governance diaries of the results that we are getting. So thinking about then what are the priority areas and cross-cutting challenges. So from the various sectors that we've already identified. So location was identified as a cross-cutting challenge. So in terms of long distance and having the sources closed. In terms of access, the inadequate or sometimes even no providers. Where the services existed, the services were seen not to be adequate, or they were not available, or the facility itself was closed. Services also identified as not affordable. There were long queues. There was a lot of lack of knowledge or misinformation. There were also interpersonal barriers feared. So for example, low self-esteem. There were challenges in terms of some services not being culturally or age or gender acceptable. Lack of privacy or lack of trust of the service providers, Infrastructural challenges, for example, lack of lighting in toilets, lack of water, lack of personnel. In terms of inclusion, particularly say for the child-headed households, lack of documentation is a big challenge for them in accessing both services or associated. So you cannot get health insurance without documentation. You're not able to have a file within the health facility. So there are a lot of things that would prevent child-headed households from accessing services because they lack documentation. Discrimination was identified as a challenge. Social barriers, or sometimes having facilities which are not designed to accommodate, for example, persons with disabilities or older persons. Language barrier was also identified as a challenge. Lack of assistive or adaptive or rehabilitative devices was also seen as a challenge. In terms of safety, safety was identified as an issue, as a cross-cutting challenge in terms of, for example, no flood lighting to access services. So if you want to access a toilet or a water point at night, you feel unsafe because there's no lighting. Some of the facilities themselves were seen as unsafe. For example, toilets for women at night, unsafe practices within the community. So this study was done during the 2020 lockdown. So there was also the fear of COVID-19 infection and also emotional barriers and trauma as a cross-cutting challenge. So I think that brings me to the end of my presentation. This is a study that is still ongoing. Based on these results, we are planning to conduct, we have actually conducted a household survey. The results are still being analyzed. And then we will still work with the communities to see then how can they try to improve some of the services. I would like to acknowledge our funders, which is the UKRI, plus our partners here in Kenya, which is LVCT Health, SDI, the Slum Dwellers International here in Kenya. As I said, this is a collective work being done across 4 countries with partners from the UK. With that, I come to the end of my presentation. Thank you for your attention. Thank you.
Thank you, Caroline. Thanks, everyone. Please keep your comments going. We want to ask Ivy to, Ivy, go as fast as you can. I think time is catching up with us. Ivy, are you ready? Go.
Thanks, Blessing, and thanks, everyone. I am going to share part of the work that Caroline has already presented, but more so this is part of my schoolwork. And most of the presentation that Caroline shared said that there's a PhD program that's embedded in the work. And my study is on water, sanitation, and hygiene in Nairobi informal settlements. And it's basically in the childcare centers where most children spend most of their time when parents go to work. And WASH is important for education and also health of the child. And what is clear is that most benefits have not yet been achieved fully in low-income settlements and more so in the informal settlements. And basically at the informal settlements where women take their children to the childcare centers and go to look for work, children basically are left at the childcare centers, and in the hope that SDG goal number 6 of safe water and sanitation and SDG goal 4 of ensuring safe environment is expected to be attained. But then there's usually lack of data, and no one knows actually if really water, sanitation, and hygiene is achieved in the childcare centers. And in 2019, there was just a cumulative representation of data for school setups. For water, that was 53%, 45% for sanitation, and 13% access for hygiene. And it's actually been an issue because there's no data on access to water, sanitation, and hygiene in the which is disaggregated. But what is even making it worse is that when you disaggregate primary school, secondary school, we do not have data for drinking water for pre-primary education, and it is the same for basic sanitation for pre-primary, it's insufficient data to make disaggregation, and same for hygiene. And therefore, I wanted to find out more just about the level of access, and also who is responsible for whom and for what, and also how they are responsible. The study was done in 2 informal settlements, and I'm not going to go further into it because it's embedded in the ARISE project. And before the data collection, there were outreaches both at the community level and also at the school level, because we did the study at with the parents at the community and also with the daycare providers at the school setup. It was a mixed method project that was done in 2021 and also in 2022. Using governance diaries, a survey, focus group discussions, and co-creation workshops. And the access to WASH is really different from what you would expect because of COVID-19. In most instances, would usually expect hygiene to be at the lower level, but because of COVID-19, there's high access of basic hygiene, and also basic and also limited, and limited or no service was low because of the presence of many actors at the community level who then avail water, sanitation and hygiene at the community level. So the hygiene was mostly a focus of many actors during this period of COVID-19, more so during the peak periods, and hygiene went so up, and followed by water, and sanitation was least a focus, mostly because of the reason why sanitation was not taken as key during the COVID-19. It was mostly taken as an individual responsibility at a home level or at the school level, and there were no actors who would then visit the community to avail sanitation facilities or to train people on sanitation, compared to capacity building and resource mobilization that happened for hygiene and water. There were also some differences for the 2 different study sites. And most cases, one of the informal settlements, Korogocho, is mostly communal, and you'll find that the water or hygiene services that would then get into the community would be shared compared to the services that would get into the other informal settlement, which is Viwandani. In most cases, Viwandani is capitalist, and you'll find that when one gets access to hygiene detergents or hygiene facilities, they would then mostly keep it to themselves compared to this other study site. And it's same for water, which was more better for the informal settlement, which is communist, than the one which is capitalist. Same for sanitation still. And in trying to get the last part of it on the actors were, there were more actors, but the key actors were basically childcare providers and the parents who were available most days and almost every time to avail WASH services at the childcare providers. And despite that, these were the key actors, there were also some actors who would work through the parents and the childcare providers, or they would be available occasionally to avail water, sanitation and hygiene, and were non-key actors. There were networks, and the networks were either direct, possible or desired connections. And this actually networks enhance the availability of WASH in the childcare providers, because everyone would want the children to have healthy life at the school or when they are at the centers. And the direct connections would come mostly from the informal actors at the community level, the parents, the extended family, the neighbors, the close friends, and would avail WASH services directly to the childcare centers. But then there were possible connections. The possible connections were the networks that were available at the community, and they would avail WASH services, but they were not in a position to avail the services at the child care center itself. But then there were desired networks that were felt to be having influence generally in the WASH sector, including the government, but could not be in a position to be felt in its presence in provision of WASH services at the community level. And that's actually, there were social accountability mechanisms that included discretionary actions, norms, values, and facilitative behaviors that would help the key actors, the parents and the center providers, to ensure availability of WASH services at the centers. We went further to do a co-creation because we wanted to sustain the water, sanitation, and hygiene as it is, despite that we know that it's through COVID-19 that ensure that there's proper or available water, sanitation, and hygiene that is improved. So we did a co-creation process together with the community members, the parents, the center providers, and actors in WASH to come up with a process that would help us to sustain the levels of water, hygiene, and sanitation. In conclusion, there are many conclusions, but just one conclusion is that there are many wins for water, sanitation, and hygiene, but for the quick wins, it's important to ensure that the sustainable solutions for the quick wins to be able to sustain those quick wins. So this work was funded by GCRF UKRI. So I acknowledge them, the African Population and Health Research Center, the Horizon Consortium, the study communities, my supervisors. Yeah, thanks. I stop there. Thank you.
Thank you, Ivy. Thanks. I like the quick wins aspect. I also like those networks, because it tells you what is actually on the ground, which we can build on. But we leave that as we get to the last presentation by sisters. But what is key here, as Faith and Jijo, as they load their slide, if they have, is to show us that there is a lot on the ground, a lot of structures on the ground, which can complement the structures that are formal and the structures that are global to deliver services that would then help us achieve inclusion, achieve sustainability, achieve leaving no one behind. But very, very interesting dimensions and discussions. But Faith, you take it from here.
Thank you very much, Blessing. I hope you can hear me.
Yes, we can.
Thank you. Yes, we want to share our thoughts with regard to the Sisters Project. And the title we were given was to look at the invisible, and that is women leaders in STEM. And we just want to share our thoughts because that is basically what the Sisters Project is going to be. And I'm going to be presenting this together with my colleague from Ghana, that is Jijo. So I'll do the first part and then she'll take over from me. And so quickly into just putting our project into context. The gender equality is something that is very elusive. And this is, has to do with, trying to ensure that no one is left behind, like Blessing mentioned. And so this particular goal, tries to emphasize the fact that gender equality is not only a fundamental right, but it's also necessary for a peaceful, prosperous, and sustainable world. And so the issue of providing women and girls with equal access to education, healthcare, decent work, representation in both political as well as economic decision-making processes is very critical or important in fueling sustainable economies and by and large ensuring there's benefits to societies and humanity. And you find that this particular goal has 9 targets and 14 indicators. And I just share a few indicators in terms of how the tracking has been done. And you find, despite the lack of data, you know, a lot of insight is coming out with result, or as a result of trying to demonstrate that there's a lot that needs to be done if we are ever to achieve this gender equality. So for instance, if you look at the legal frameworks, you know, at the global scale, first of all, where you're seeing gaps, there's a lot of data that is not available. But even where we have data, it appears like as much as we don't have many countries that consider perhaps gender equality as an issue. And yet, like we are saying, if we are going to achieve no one is left behind, then this has to be anchored, you know, in our legal frameworks. Then, as much as we may also be having these legal frameworks in the various countries, the issue of a mention of non-discrimination clause with regard to gender, again, that is something that you know, that perhaps is an indicator of the importance that different nations, you know, place with regard to ensuring gender equality. And you can see in Africa, it's actually very interesting. We have a mention of gender, you know, within our within the many legal frameworks that do exist. But the question also is whether this has translated into, you know, into tangible impact, so to speak. So in addition to that, we look at non-discrimination law with regard to gender hiring. Again, we are seeing the red is an indication that there is no law that you know, that is non-discriminatory with regard to hiring. And you can see with regard to Africa, we have many reds, which means that they don't pay attention, you know, in terms of providing that framework to ensure that there is, you know, gender when it comes to hiring, in terms of hiring processes, job advertisement, selection criteria, as well as recruitment. This is not really a concern, so to speak, just putting it bluntly. So again, that will translate into what we are actually trying to, or we are experiencing, as it were. So looking at women and positions, again, because our study is both Kenya and Ghana. And I just wanted to pick out on two things. One, looking at women in ministerial positions, you know, those are high decision-making levels, as well as women who are in national parliaments. And you can see the data that is available does indicate, when you look at the y-axis, actually, you look at most constitutions talk about representation should be by either gender should be 30% at a minimum. And so if you look at ministerial positions, this is something that is not well, you know, taken care of, so to speak, for both Kenya and Ghana. And even at the ward level, on average, we are seeing a situation where we have representation at less than 20%. When it comes to the national parliament, again, a comparison between Kenya and Ghana, again, we are seeing as much as we are putting Kenya slightly up, but we are still below 20, we are still not yet at 30%. And in terms of women in top managerial positions, we have data for 2013 for both Kenya and Ghana. And you're seeing, again, less than 20% for both countries, according to data by 2013. A lot of data gaps, okay? So meaning that in terms of trying to address policies, interventions, there's need for data. Now, coming back home, in terms of STEM, you know, looking at STEM programs and careers, because that's where our focus is. This is information on data that was taken, you know, in a country or rather in the US. And you find that from the time, you know, you have students enrolling, you know, in lower levels, up to the time when we are generating, you know, STEM graduates, at the end of it all, we end up with only 4% graduates, graduates who are in the STEM fields. So again, that is telling. And then when we come to women now, and this is an example of the medical field, when you're talking about engineering, that's a ball game altogether. That's even worse. But if you look at the pipeline, you find that again, at higher levels, we are actually having a lot of leakages. So another challenge that needs to really, that really needs serious interventions. In terms of, academic progression, again, you look at, by the time we are graduating bachelors, we are more than 50%. By the time we are getting to female researchers, according to data by 2015 UNESCO, you find that we only have 28% of female researchers. And if you disaggregate these data to the various fields, like you go to engineering and the rest, you find that the data is, or rather the percentages are actually even less. Now, the issue of STEM, a lack of STEM, lack of diversity, equity, and inclusion in STEM has been attributed to three main areas. One, individual choices, and we have seen also systemic barriers. Because of the leakages in the pipelines, there is an indication that there are systemic barriers that need to be addressed. And also layers of biases. These layers of biases continue to exist and to actually impact on women actually progressing and also ensuring that we have diversity, equity, and inclusion, particularly in the area of STEM. And just to highlight this invisibility, if you look at the top technical fields, where we have women, so to speak, represented. Women in terms of technical roles, you can see the percentages in Facebook, Apple, Amazon, all the way to Huawei and Samsung. You are seeing women in technical roles, they are still very few, but even when it comes to leadership, again, we are still seeing the percentages being very low. So the long and short of this is that women are still very, very marginalized when it comes to the STEM fields. And we do hope that as we progress with our project in the Sisters, we'll be able to bring out, some of those systemic barriers that need to be addressed so that, we ensure that there is equity. So I'm going to request my colleague, Gijo, to take it over from here and just give a brief of what the Sisters Project is all about. Gijo, over to you. I'll scroll for you.
Thank you very much, Faith, and good morning to everybody, and for giving us a very clear situation, especially regarding gender equity issues and the situation in the STEM field when it comes to women. I'll present this morning on our Sisters Project, and to say that with the Sisters Project, we are just about getting into the field to collect data, and so the presentation will be focused on what we want to do. Sisters is an acronym from the project title, which is Transforming Institutions to Advance Women Leaders in STEM. And we are going to learn lessons from Ghana and Kenya that would serve as a comparative analysis for us. In fact, the study is aimed at looking at these contextual differences, especially within the West African region and East African region. Next slide, please. Great. So the objectives of Sisters is basically to contribute to the advancing of women in STEM, in industry and academia. We have seen, as per Faith's presentation, that there's a lot of leakage. And for the sisters who remain within for the sisters, and for that matter, for the women who remain within the pipe of STEM, there are also issues in terms of career advancement and career pathways. Now, we identified that this isn't a straight line thing to do. It's a network of complex issues that need to be addressed. And to be able to achieve that, we thought that it would be great to have a good comparison assessment, and for which reason we have East and West Africa. The other thing that we bring on board on this project is the fact that the team is made of an interdisciplinary, multidisciplinary stakeholders. And even within the disciplinary interdisciplinary, we see people with coming from academia, coming from industry, coming from NGOs, who are all parts of this research. And so the fact that we are focused on women and looking at women progression, that doesn't mean that we not look at the men. In fact, there are many lessons we seek to learn from the men experience, and also have men participate in the research as well. We also bring on board a lot of skills to help us be able to disaggregate the issues that are very important. And these are the skills are in the areas of gender, organizational development, mentorship, and transdisciplinary approaches. These are just examples. Next slide, please. Well, the composition of the Sisters Project, as we have already indicated, is being conducted in 2 countries, that is Ghana and Kenya. And the project leadership is being led by Ghana, which is the University of Ghana, and co-led by Kenya, by the University of Nairobi. We do understand that the participating institutions are also varied. So we have academia, like I've already said, which is University of Ghana and Nairobi. And then we have those working in the sector. So we have, for instance, APHRC, which is into population and health research. And we have women in water and sanitation. Of course, these institutions would provide the core research team members for the Sisters Project. And as part of our work, which an integral part of our work is to build capacity, building capacity of the next generation. So we'll have in Ghana the training of 8 MPhil students and 10 postgraduate students in Kenya. Next slide, please. Our methodology is focused on what we call the transdisciplinary approach, where we seek to not only use the straight scientific method to unravel the issues that we want to have clarity to, but we also focus on non-academic knowledge. So you would find out that even within the project structure in terms of the research, we have stakeholders from different disciplines in the social sciences, the humanities, which is a reflection of the departments that we have working in the various institutions. So for instance, in Kenya, we have the Department of Geospatial and Space Technology from University of Nairobi. And in Ghana, we have the Institute for Environment and Sanitation Studies, which is an environmental science focused institute. And then also we have Department of Geography, Institute for Social and Statistics and Economic Research, and School of Engineering. And to talk about the fact that those working on the ground, WIWAC and APHRC, are all parts of this transdisciplinary process. Next slide, please. So since our study is focused on identifying the issues that try to, or that prevent or limit the advancement of women, we are going to focus the work on institutions. And we intend to work within the academic and research institutions as well as industry. So just to map up, give you an overview of what we will do in terms of methodology, we'll first identify the study institutions that would work in. And then within those institutions, we'll do a stakeholder mapping to understand how people within the STEM careers, how they fit within the whole institution. And then we'll also go ahead to do an assessment of the career pathways of both men and women, and also try to have in-depth in conversations with those who have succeeded, that is females who have succeeded, what propelled the succession, what were the challenges they faced, and likewise for males, and if possible, people who have even exited from the STEM sector, so that we also try to find out what are the major issues that lend to exiting from STEM. Through all this, we hope that we'll be able to generate enough information that would inform the co-development of innovative solutions. And the co-development is structured such that the identified study institutions would work with the research team to co-develop or co-create what strategies, innovative strategies they think would enhance promotion of women in STEM into leadership position in their institutions. Our expected output from the research, we hope that we'll be able to generate data on the STEM institutions in Ghana and Kenya, would have gender disaggregated data on professionals in STEM. And then we hope that we can also set up a system that will encourage women in STEM to be in networks and stay in networks. So we call it the KISTEM, and then also document successful stories of women who have been able to achieve or broken the glass ceiling as a way of encouraging even the up-and-coming women in STEM. Next slide, please. Our project is structured in work packages, and we have 4 work packages. The first work package is focused on looking at the policy review, policy situation in both countries at the national and institutional levels, and we are looking at policies related to gender and STEM. And the second work package is focused on looking at the gender and occupational pathways. So our study would seek to understand all the gender issues when it comes to career pathways, advancement, and leadership.
Okay. Hello, Gijo. Are you able to round up now?
Yes, let me round up quickly. Our third work package will focus then on women and men who have succeeded, whilst our fourth work package would look at the innovative strategies. Last slide, please. Just to share a few quotes of what has been inspiring us as researchers to do this. The first one is the power of visibility can never be underestimated. And then I would also want to say that there's no limit to what we as women can accomplish. Thank you very much. I want to use this opportunity to thank
Hello.
Hello.
All right. So we thank you. Thanks, everyone. I'm sorry. You see, I think we were really very ambitious, but these are very insightful presentations. Faith, I don't know whether we will go on with that break, but I want to hand over to you to coordinate the responses from our global partners and our funders who are here. I will suggest that maybe we go straight to it so that people can then begin to respond. There is so much already to chew. Thank you, guys. Thanks for listening. Thanks for great presentations. I wish we have a whole day. Thank you, everyone.
Okay, thank you. Thank you very much, Professor Blessing. I think we'll just go straight, like you have said, so that people don't forget when it is still fresh in our minds. And so the next session is more or less a panel session. And I know in our session, we have PIs in the various projects as well as funders. And so we have the 3 projects, that is the KUSH, ARISE, and Sisters. And so we want to now go straight to the intro, maybe just a brief, very, very brief for the various projects. And I start with ARISE. Maybe we get to know who the PI is, the role of the PI, perhaps, and the funder, perhaps. They can introduce themselves. So over to the ARISE project, kindly. Thank you. And 5 minutes, actually, maximum. Because of time.
Sure. Can you see my screen?
Yes, you can see the screen.
I'm going to rattle through it really quickly. Thank you everyone for absolutely wonderful presentations today. I'll just start my video so you can see me. I'm here in Valencia in a very unglamorous Holiday Inn on an industrial estate by a plastics factory, because place and space are really important, so you should know. My name's Kate and I'm the communications manager. So in terms of our goal as ARISE, what we want to do is create significant change in relationships, both internally and externally to informal settlements, so that people can generate solutions on health and well-being. But simultaneously, we want improved accountability so that those people who have self-organized in slums or informal settlements are responded to by the state. So we want to build the capacity of policymakers to respond to the problems that communities identify. So our presentations from Kenya have given you a fantastic overview of the work that's occurring there. But there's a wide array of partners, and we're working in India, Bangladesh, and Sierra Leone as well. We have some UK partners, one of whom is the PI and others who collaborate with us. So as you know, we're using action research. So this learning together cycle, which allows us to look at different issues throughout the life of the project. We've got I think about 18 months left. So we're very much in this synthesis and learning phase. So this is why this panel is such a wonderful opportunity for us. And so nice to hear about projects from Kenya, where there's this shared problem identification and new and different ways of thinking about equity and systems. So I was so interested to hear what you had to say. I think one thing that comes through really strongly in terms of equity is the process that you use, right? How you embody your values in terms of equitable partnerships. So we're doing that with communities, but we're also doing that among ourselves. So we have a set of values that we try and work to and that we assess over time, so we know we're reaching our goals, which is around equity and voice, in power, in resource distribution, transparency and accountability among ourselves. And you can't demand of other people something which you don't embody in your own working life. Continuous co-learning for everyone, for everyone, from everyone, to everyone, across the countries, with the communities, with the policymakers, and a commitment to ethics. And I think this commitment to ethics is something that I've heard echoed in other sessions in Valencia here, particularly when it's people working with the most marginalized and using some more of these participatory methods. So it would be nice to hear from people who use different methodologies about their ethical frameworks too, as it's important, and we don't talk about it enough. So I said we use equitable partnerships. So what are some examples of that? Well, we were really responsive during the COVID-19 pandemic. So we work on health and accountability, and we take our lead from the communities, which meant that we had a responsibility to pivot to COVID-19 when there was a crisis. And Ivy's presentation talked about how, surprisingly, hand hygiene and so on have been taken up because of this crisis. So I think we've heard today and heard this week in the conference that crises can sometimes be an opportunity for cross-sectoral working, and certainly in COVID-19, that is what we've seen in different settings, and indeed, we were part of it. Another example of equity that we bring in is that we have data ownership and agreements that prioritize low and middle income countries, and within the country partnerships. Obviously, data ownership with communities is really important to the way that we do our work. Our publication guidelines are really explicit about providing recognition, not just for people in low and middle income countries, but people who may be marginalized on other axes. So women researchers, early career, mid-career researchers as well. And we monitor that to make sure that we live our values. And we try and have representative authorship lists. So our first publication to sort of define concepts on health, well-being and accountability was co-authored by all of us, which is a massive group, and which does lead to some contestation with journals. But that's what we're here to do. We're here to trouble some of these power imbalances that you find in urban health. So just to say, solidarity is part of how we live our values in the research. And these are some pictures of the COVID-19 response by communities in different countries that we supported. And that included helping with mental health, with food and resource distribution to informal settlements. Also work on people experience intimate partner violence, particularly in Kenya. That was a key thing for LVCT Health and other people. We have a big focus on PhDs, as I said, early career researchers. They're the people that we want front and center. So wonderful to see our Ivy up here, 3 presentations in this conference, all of them excellent, very good work. We're also trying to spread ideas. So one of our partners is Slum Dwellers International, and we're using their network to spread these ideas to other countries beyond the ones we focused on initially. We're also thinking about the way we communicate research findings, so not just your journal articles, communication all the way through, and making sure those formats are fit for everyone. So thinking about accessibility in terms of literacy, thinking about accessibility in terms of disability, thinking about accessibility in terms of the time people have to try and get this information into their brains, because we're in a very sort of information busy environment. And we have a strong focus on advocacy, and that's only going to grow as we do some more global level work. So get used to seeing us in conferences and in these global spaces, because that's where we're going to be over the next year or so. And yeah, I know a lot of geographers around, you like a map. If you wanted to explore the different work we've done, we have this lovely Kumu map, which allows you to look at the different themes we work on, the different types of resources. So have an explore of that and have a look at our website more generally. For my sisters in Sister, I loved your presentation. This is from me, not really from Arise, but just last year, published a book on women in global health leadership. A lot of what we found from the different countries around the world really echoes what you were saying about STEM. So I can see that there's loads of synergies in the way that we think in terms of those issues. And with that, I'm going to leave you because we're low on time. Okay, thanks guys. It was great presentations and lovely to be part of this.
Thank you so much, Kate. That was lovely. I think you have managed to keep to the 5 minutes, and I want to just leave it at that. Then request Mike. My apologies, Mike. I think I jumped you from the program. It was not supposed to be gender insensitive. I hope you accept my apology. Over to you, Mike.
Thank you very much.
Thank you.
Can you see my screen?
Yes, Mike, we can see your screen. Thank you.
I can see we've only got 5 minutes left in the session, so I'll try and compress this down to 1 minute, perhaps, and we'll whiz through it quickly. So, okay, yes, this is the Kush project that Blessing talked about earlier. What I'll just try to do is just give the wider context of Kush just very quickly. And so, if you excuse me, I will just go really quickly through these slides. So it's a 5-year project. It's coming to an end next year, funded by the Wellcome Trust. Unfortunately, Madeline Thompson, the representative of Wellcome, I don't think Madeline could make it today. It might be that she's come, in which case she'll shout up in a minute, but she otherwise sends her apologies. So really, Kush was about trying to integrate issues of sustainability and health, and to try to work with cities to produce improved policies and improved implementation of the connections between sustainability and health, and with a really specific focus on climate change and health. We had 6 partner cities, which I'll just flag up in a second, and around 13 organisations. We had 3 main components to the research. We hoped we brought together a team that's capable of providing this cutting-edge scientific evidence that's needed, but obviously by itself that evidence is insufficient, and so as Blessing said, we're undertaking the work within a framework of participatory research, and the final of the 3 components is a recognition that cities are complex systems, and therefore we need to recognise that in the way that we work. So there's 3 main components form the basis of Kush. I won't run through all of them, but there was a large international team working with 6 international cities, chosen to have a kind of matrix of different scales, different governance systems, and different environmental challenges. We place a strong emphasis on transdisciplinary working, and colleague Helen Panillo produced this paper, which really kind of formed we tried to use it as the basis for our work, and it certainly informed. Well, there's a definition of transdisciplinary work, and I won't spend time on that now. But really, just that important point that it's an integrative process with scholars and practitioners from academic and non-academic fields, obviously working together closely. And we use that to produce a program theory for the project, which was a list of all the actions that we intended to do, and the list of changes that we hoped that might occur as a result of those actions. I won't go through it in detail, but this was the Kush program theory, the action model, as I mentioned here, the series of actions which we postulated would lead to a series of changes, and centered around transdisciplinary working. I won't run through it now. I was going to just step through the example of Kisumu and the waste management, and the bid that we made to the Green Climate Fund as an example of how we did step through each of these changes, each of these actions, and how we hoped, and we're in the middle of the evaluation process, which was informed. Our evaluation framework was based on this program theory. But I think we made good progress in the particular example of Kisumu. But we haven't really got time now to go through it in detail. But we use system dynamics. Use a systems thinking process to generate qualitative causal maps, and then a dynamic system dynamics model to enable the testing of different policy options on these criteria of PM2.5, particulate matter, greenhouse gas emissions, and health, and the impacts on those as a result of different policy options relating to waste management in Kisumu. And it enables us to work together with the whole range of stakeholders to explore what the implications were of different policy options. And then we've now applied to the Green Climate Fund for the selected policy option to be able to implement that. Again, I won't run through in detail, but the work in Kenya is, of course, just one part of the work. We've worked in, working extensively in London, in Rennes, and in Beijing, for example, alongside all of the work in Kenya. So yeah, that was a very well a whistle-stop tour through it. But these, as I say, are the 3 kind of components of Kush, and we're really trying to explore whether the range of stakeholders, including policymakers, find that way of working useful as a way to hopefully generate improved policy and implementation, and therefore improved sustainability and improved health in cities. So apologies for the really quick rattle through there, but I'm very much aware of the time. So thank you very much for your attention.
Thank you very much, Mike, and for also keeping it short and precise. So we are going to now go to the Sisters project from IDRC. Katie, are you with us? You can actually do your presentation now.
Okay, sure.
Thank you.
Okay. Can everyone see my screen?
Yes, yes, we can see your screen.
Since we're at time, I'll be very quick here. So basically, I will just mention perhaps what to look at what IDRC is basically an entity of the Canadian government and focuses on investing in high quality research in the global south, ensuring that this knowledge is shared with researchers and policymakers for greater uptake and use. And it's also focusing on mobilizing global alliances. It's really focused IDRC on it has a new strategy, 2030, and within IDRC, all of its divisions are seeking to address various SDGs. And so I think given the work that we're doing in partnership with the Sisters Project that Dijo and Faith have already spoken about, it's really why I guess IDRC is so interested as a funding entity in this project is because of the ways in which it addresses SDG 5, 9, 4, but specifically what's in the middle of this slide, which is insufficient investments in research and innovation of scientists. And perhaps to just quickly, because I know we're already at time, close the presentation is why Sisters. So I think what we're really trying to look at is how we increase, as Faith and Dijo have already talked about, but IDRC is really trying to see how we can make a contribution to increasing the number of women scientists, but as well as those who are engaging in gendered analysis in science to work towards a sustainable and inclusive development. And Sisters, because of it has multiple reasons in which it's of interest to this work that IDRC is trying to achieve. As Faith and Dijo already talked about, it's set in 2 countries that have some of the fastest growing economies in sub-Saharan Africa, yet we all know they're both very highly impacted, Kenya and Ghana, highly impacted by COVID-19. Also, this project brings together key actors who can collaborate to influence policy change. So we have 2 key universities in both countries, as well as think tanks and NGOs that can really work to influence the policy practice changes that need to happen in this regard. They examine systemic issues such as gender-based norms and sociocultural practices that are excluding women from STEM-related fields, not just the systematic issues, but also the systemic ones. They'll develop, and as Dijo already talked about, will develop and implement and study innovative interventions. The STEM initiative that was discussed. And they'll also contribute to developing a policy framework that STEM organizations can use to promote women's leadership within their institutions. And I think what's also really powerful about this project is not what's just happening within the project itself, but also what's happening within other projects and work that IDRC and other entities are supporting in the Global South, such as we have we have multiple other projects within this call that this project was funded within, but also within the Science Granting Council and an initiative that's happening right now in Sub-Saharan. So I think given that we've maxed out our time, I'll leave it there, but really encouraging presentations, and we're really happy to be working with the Sisters Project as well. Thank you very much.
Thank you very much, Katie, for that concise, again, presentation, well put. I'm now going to allow Dr. Mazena maybe just to make a comment, and if Dr. Sumba, you'd also want to make a comment on the role of weavers in the project, you could also mention, if at all you want to add something else. I don't know for Kush whether there's somebody who would also want to add something, maybe we can allow each of the projects partners or researchers to just say one or two things, and then we can close at that point. Perhaps maybe an addition to what has not been mentioned. So we start with Dr. Mazina for the ARISE project. Kindly.
Hello, hi, thank you very much. Great presentation, thank you for having us today. So I represent UKRI, which is the founder for the ARISE project. I think everything has been already said, what I was planning to touch upon as well. But for me, the takeaway from today is that the multiple sectors working together is a powerful strategy for optimizing health for all, and otherwise impossible when independent entities trying to work alone. So for take home for me from the session today is that the whole is greater than the sum of its parts. And with increasing dependency on the physical and social political environment, and the recognition that issues like sustainable development, food security, public health cannot be addressed by sectoral initiative alone. So the new integrated approaches as emerging from today's presentations that promote collaborations to optimal health for humans is absolutely fantastic. And then there is so much we can learn from yourselves as a funder. So thank you very much again for your time and presentations today.
Thank you very much. I don't know whether we have any other comments from the other projects. Kush, do we have any other additions?
Yeah, maybe Mike can talk about the future of Kush in a minute. Mike?
Okay, Mike, over to you.
Thanks, Jen. As I mentioned, Madeleine Thompson from Wellcome sends her apologies, but yeah. So we're hoping and planning to keep the Kush team together. I mean, it's taken a huge amount of work, and we're incredibly grateful to Wellcome to fund that bringing together of the team and establishing ways and methods of working. So we're Wellcome. Are in the fortunate position of having some substantial funding to allocate to this area, and in the coming year or so, then we'll be all be well making applications to try to ensure that the work can continue and be extended into different cities and different locations. So yeah, I think hopefully exciting times ahead, and thank you to everyone involved in the Kush team for getting us where we are, and thank you very much to Wellcome for the funding. We really appreciate it.
Okay, thank you very much, Mike. Dr. Sumba, would you want to add something on the Sisters Project?
Yes, just a little bit. Thank you very much. So WIWAS is an association of professional women whose aim is to strengthen the role of women in water and sanitation management. Now, the Sisters Project on the Kenyan side has picked on WIWAS as a case study for the water industry, which is male-dominated. And as we speak, our water service providers are among 88 managing directors. We only have 4 as women. And therefore, we can see that they are invisible, and the ideas do not necessarily lead to implementation. So we need a critical number of women to be at decision-making levels. So for the Sisters Project, success for us would mean identifying the selected organization and together understanding what needs to be done. Success would also mean that getting the critical number of women at higher levels in organizations. And then it would mean also capacity building these women where gaps are identified, and then the women are equipped to take up leadership positions. And again, every organization is unique. And in some way, there is a need to look at the institutional culture of decision-making and together make interventions for best practices. So I think this Sisters Project will go a long way in bringing women in the male-dominated water and sanitation sector to the fore going forward. Thank you very much.
Thank you very much, Leonita. And I think with that, I just want to take this opportunity for allowing me to chair this panel session. So, though very short, but I think we have communicated. The information is out there. And we have opened up, now more interactions and see how the 3 projects can actually build synergies. Thank you very much. And now over to Carol to wrap up the program. Thank you.
So great, very great presentations, a lot coming out, but as we said, in the interest of time, we don't want to make this too long. Thanks for that, Kate, short and sweet. And it's nice to see all the synergies. So I'll just read out 2 things that have stood out for me, and it's from your presentation. The first is that the power of visibility can never be underestimated, and how it is discussed and whose voices are heard has an impact on what happens next. I think those are good words to close the session with. Thank you.
Thank you, everybody. Thanks so much, so much. We are sorry we overshot by 10 minutes, but it's so rich that you don't even know how time flies. But it's a great group. You can see transdisciplinarity, you can see multidisciplinarity, you can see multicultural, multi-country. You can no longer say, oh, I just did anthropology, man. Those in space science need anthropological insight as well. So we're also happy, Mazena, for coming. You can see that your funding is going somewhere. You could actually see it. So maybe you should also go home and think of maybe there should be more funding. Unfortunately, Welcome is not here, but Mike should be able to communicate that. The same with Katie. I think it's very important for us to see that all of us are able to work together. There's a lot of synergy. There is a lot of software dimensions of these things beyond the hardcore science. So thanks everyone again. Please accept our apologies for overshooting. We were really very ambitious, but I think it almost paid off to the time. But thanks again, and God bless everyone.
Thank you, everybody. Thanks everybody.